come here and pick them up before the show. All right, everybody. Anybody who's told you that they have to have an operation probably expects to have some post-surgical pain. In fact, the anticipation of the extent of that pain could make some delay that surgery or even put it off completely. Well, this morning, we'd like to introduce you to some folks who really may be able to help you with that. Dr. Rose Burkun is the Assistant Professor of Anesthesiology at SUNY Buffalo. She's also on staff at St. Joseph's Hospital. She's here with Tom Orsini, the COO of Sorensen Medical, here with a former patient, and we have Jeff File, who had a shoulder operation. And we're going to tell you today how a device that's manufactured by Sorensen Medical made Jeff's surgery practically painless. And Dr. Burkun, I know you're excited because working over at St. Joseph's, you use this device and you see how it works firsthand.
Absolutely. First of all, Linda, thank you for having us on the show. We're very happy to be here. This is very exciting. It's the latest in post-operative pain management. Traditionally, patients have no choice but to either go on a pain pump or to take narcotic medications orally. This replaces all that. The regional anesthesia is similar to having a Novocaine injection for a dental procedure, except it's on a bigger scale. An anesthesiologist can isolate the nerve that supplies only the area of the body where the surgery will take place. This way, the surgery is painless, and when the patient wakes up, they feel no pain. But we don't stop there. We extend it. So before the block is done, when the needle is still there, we can insert a small catheter and leave it there. After the surgery, that catheter is connected to the pump and a continuous infusion is started. Patients go home on that continuous infusion and remain pain-free for about 3 to 4 days afterwards.
That's incredible, because so many people will tell you the worst part of their ordeal was maybe the day after surgery or 2 days after the surgery. When they're starting to wake up and they're really starting to, I guess the hospital tries to figure out how much pain medication you need, so sometimes you're without it. And it's an awful experience, and this can really take the anxiety out of going to have a procedure that you might really need to have.
Absolutely. It also eliminates the need to stay in the hospital for the first 24 hours just to get that pain pump. Patients are discharged home very quickly, sometimes within an hour, if not less. And that's what we did with Jeff.
Wow. Now, excuse me, Tom, for a second. We're going to jump over to Jeff. Jeff, what kind of operation did you have?
I had shoulder surgery.
Shoulder surgery. And did they tell you they're going to try this?
Yes.
And you said, hey, bring it on?
Yes.
All right, so what kind of pain were you anticipating, and what kind did you have?
I talked to a couple people before, and shoulder surgery is supposed to be pretty painful.
Yeah?
And I remember waking up from surgery, and I had no pain.
Wow.
Nothing.
Terrific.
What you're seeing right now is right before the surgery started, where I inserted the catheter, the brown stuff that's just betadine to keep the site sterile.
Wow, look at, now that's you, Jeff.
Yeah.
That's
right,
there you
that's
are.
him right before the surgery.
Is this similar to an epidural?
It's very similar, except epidural will numb everything from the waist down. This will only numb the region of the body. And here you see Jeff right before the surgery. This is the position where he was during the surgery, in a very special chair. That's why he had to have general anesthesia on top of that. However, he received no narcotics during the surgery. He got very little gas, anesthetic gas, and he woke up right in that position on the table.
Wow, and look at all the people who have problems with general anesthesia. This, I mean, they get nauseous and this and that. This would alleviate all of those problems.
Yes, it eliminates nausea. There is no pain. They feel great. And this is actually when they were doing the surgery on Jeff. They're just starting, they're inserting the first instruments, and even though Jeff was under general anesthesia, his body felt no pain whatsoever, and it did not respond to the initial surgery.
So maybe not in Jeff's case, but you might have patients who don't need to be asleep.
Absolutely. I have many patients who stay awake, or they're just lightly sedated for the procedure. They avoid the gas, they avoid the breathing tube, they don't need to be intubated. Yes, and again, they can go home the same day.
That's
they
incredible.
don't need to stay in a hospital.
And we want people to know that St. Joe's is where you're doing this.
Yes, it's right now it's available only at St. Joe's, but more and more anesthesiologists are starting to do continuous regional anesthesia. So the Buffalo General Hospital is starting to do that, and I'm sure within a couple of years it will spread to all the other hospitals in Buffalo.
Now, if it does, it would be because of Tom. Tom, hold up the device, and this is the device that Jeff went home with. Are you the only folks making this?
Yes, right now.
Isn't that incredible? So this might be going all over the world.
currently is going all over the world. We do sell it in Europe, Asia Pacific, as well as in the U.S.
Wow, that's terrific to know that something like this is being not only made but marketed here in Western New York. This is going to be such a terrific addition to a doctor's arsenal to be able to help people. Have we used this? You were telling me, doctor, that this has basically come from an idea where they use for triage overseas for battle
Absolutely.
wounds.
I learned about it when I went to see soldiers at Walter Reed Hospital. And this was introduced to battlefield where soldiers, they would be injured and in horrible pain, and instead of giving them a lot of morphine, they would perform these continuous blocks, attach the pump, and send them to Germany, and after that send them to US to Walter Reed, and all with the same continuous infusion. And I was just so impressed. I knew that we can extend it to sports injuries, to any type of orthopedic procedure, and that's what we did. Our program is fairly new. We started it a year ago, and it just became very, very successful. We have a lot of very happy patients, such as Jeff, and we hope to continue it.
That's great. And Jeff, you were able to, you had a nurse visit you at home, and if you needed to monitor the pain relief, that person could adjust it for you. So you really never felt any pain at all.
I was numb from my shoulder to my fingertips for 3 days.
Wow, what a gift. You know, Tom, it's got to make you feel good when your folks are working hard on something like this that's going to help so many people.
It really does. It's very rewarding to everybody at Sorensen Medical, because pain is the #1 concern of patients going into the hospital. And it's also the #1 reason why outpatient surgery patients are readmitted into the hospital.
Wow.
And it's also very rewarding, as Dr. Burkun stated, where this pump is being used on the battlefield in Iraq and transporting our wounded soldiers back.
So if you would like to have this done, you should really talk to your doctor about getting privileges over at St. Joseph's right now, because they're the only folks who are doing this.
Pretty much, yes, to that extent. It's really state of the art. Fortunately, we have many wonderful orthopedic surgeons who work at St. Joseph Hospital. So chances are that your doctor is already on staff at St. Joseph Hospital. You just have to ask.
I would imagine insurance picks this up, this type of anesthesiology, because it's really saving you time in the hospital.
That's the best part, that all this is done with no extra cost to the patient. Because insurance covers everything. They cover the pump, they cover the infusion, they cover the hospital cost, and the insurance is happy because they don't need to pay for that extra day in a hospital. So they end up saving money in the end.
Wow, and just the overall general health of your patient is better if you don't have to go under general anesthesia.
Absolutely.
You know?
Absolutely.
So that just is terrific. Now, Jeff, did they ask you, can you feel this? Can you feel, is that how they knew it was all taking place and it was all working the way it should?
Before I went to surgery, Dr. Burkun laid me on my side, and I felt my shoulder jumping, and I was asking her what was going on, and they were putting voltage in my shoulder to find the nerve branch, to find where they had to do the block, and then I went to surgery and I woke up and then I had no pain.
Wow,
but
yeah, but that was of really no discomfort to you whatsoever. Nothing. That's incredible. And then to find out how down the road this will have so many more applications, that's very exciting. That's so terrific that we, again, another Western New York company is behind this. And Dr. Burkun, we thank you for explaining it. Tom Orsini, we're thrilled that Sorensen is behind it all. And Jeff, we're happy for your recovery.
Thanks.
We're thrilled that it all worked for you and it could work for you as well. For more information, we're going to have you log on to painfreeplus.com, painfreeplus.com, or you can give them a call at 891-2300, 891-2300.